All right. Hi, I'm Crystal Tran. I'm currently a high schooler at Pineview School, and I'm also a REACH intern at the Gulf Coast South Area Health Education Center. On the screen right now, you can see all the different REACH student programs, which I personally am part of. So today, I'm pleased to be the interviewer for Dr. Tran. Dr. Tran is a licensed physician with a specialty in anesthesiology and general anesthesiology. He received his medical degree from Tufts University School of Medicine and has been in practice for 17 years. Currently, Dr. Tran works for the Sarasota Ambulatory Surgery Center. Next, we're going to watch a video on what anesthesiologists do.
For centuries, surgery was often an agonizing experience. Through advances in medicine, anesthesiologists are able to make operations virtually pain-free. Except in emergencies, the anesthesiologist usually meets with the patient prior to the surgery. The doctor will ask about the patient's medical history.
No problem with high blood pressure, diabetes.
And explain the type of anesthesia that will be used, as well as possible side effects.
Anesthesia, by and large, is very, very safe. In rare instances, there are complications.
Before the operation begins, the doctor administers the anesthesia and checks to see that it's taking effect. The anesthesiologist monitors the patient's vital signs, heart rate, blood pressure, body temperature, and breathing. The amount of anesthesia may need to be continually adjusted to ensure the patient is properly sedated. It's a mentally demanding, high-pressure job. The patient's life is in this doctor's hands. Most work is in operating rooms at hospitals or surgical outpatient centers. They may also handle pain management in intensive care units and during labor and delivery. Hours can be long and irregular. Even after the surgery is completed, anesthesiologists continue to watch over patients, ensuring they come out of the anesthesia successfully.
Operation's finished. Everything went well.
Anesthesiologists train longer than many other physicians. In addition to medical school and basic residency training, anesthesiologists need 1 or 2 additional years of residency in their specialty. Millions of operations are performed each year. Many of them just wouldn't be possible without the knowledge and expertise of anesthesiologists.
So anesthesiologists administer anesthesia or sedatives and monitor patient conditions while patients are sedated during various medical operations such as surgeries and other procedures. While patients are sedated, their lives are in the hands of the anesthesiologist. Now that we know what anesthesiologists do, I'm going to ask Dr. Tran some questions so that we can get into the specifics as to what his career entails. So, Dr. Tran, what is your job description?
All right, well, thanks for having me on the talk today, Crystal. In a nutshell, my job is to help patients both mentally and physically endure the stress of surgery as they go through the surgical procedure. So in other words, we are there to keep the patient safe and alive as they go through the surgeries.
I didn't know that they also did mentally. That's also really interesting.
Yes.
So currently, where do you work and what is the atmosphere like?
So as you mentioned earlier, my workplace is called Sarasota Ambulatory Surgery Center, but the environment we're working is mainly in the operating room. And the atmosphere in the operating room is, I would describe it as a team approach atmosphere, because we're all there as a team. Each person has a specific duty or job to do, but we all work toward a common goal, which is to get the patient through the surgery safely so that they can be better in the end.
Would you say that that team approach to surgeries is specific to your workplace or general in most hospitals?
Well, I think it should be a common thing across the hospital or different parts of the hospital, but I think it's most critical in the operating room because that's where all the real emergencies or high-risk things that could happen. And if you don't approach it in a teamwork mentality, success is not guaranteed.
And what kind of patients do you work with in your career?
I see patients who need help for surgical procedures where they cannot endure themselves. So there sometimes could be common things like having an MRI or a CAT scan, but patients sometimes cannot handle it mentally, then we're there for them. Besides the things that you usually know about, like the big surgeries, like heart surgery, brain surgery, abdominal surgeries.
Do
So
you,
all sort of things that patient cannot handle physically and mentally.
do
With
you
them.
usually interact with the patients prior to giving them the anesthesia?
Yes, and that's the thing that to me is the least satisfying, because usually we only have about less than an hour to interact with the patient, get to know the patient, and for the patient to get to know us and put their trust on us so that we can take care of them during surgery. So that's what we do. We don't have the luxury like surgeons do, where they get to see the patients a few days or weeks before the surgery. We just see them on the day of surgery, prior to the surgery.
And what is a typical day like?
Well, it depends on the setting of your work. I used to work in a hospital, and the day starts at 6:30 and it ends, could be anytime, could be late at night. When we take calls, it'll be 24 hours, and we could be in the hospital the whole 24 hours. These days, I work at a surgery center, so the hours are more constant or predictable. We start around 6:30 and we finish around late afternoon or early evening.
That's a long day still.
Yes.
Wow. So how many hours do you work per day or week? And how do you balance your personal life with your work life?
Before in the hospital setting, it's harder to balance life, personal life, and work because when you take 24 hours call, you don't know what you might encounter during that 24 hours. The next day, you may be very tired, and even though you're home, you're off work that day, you might not have the energy for your family or your personal life. These days, with the day surgery setting, the hours are more predictable, so I can be home and have dinner with my family's wife and kids and share their life. And so that way it's more balanced.
And what type of starting salary can a person expect in this career?
Well, you could expect to start in the low 300,000s and up. But there's a big range, depends on the specialty that you go into.
So there are different specialties of anesthesiology?
Yes, there are some. There's pain specialty, which is getting paid probably the highest. And I would expect that to be in the 400, 500, even 600,000 a year. There's intensive care specialty, which probably not much higher than the general anesthesiologist. And there's also regional specialty, regional anesthesia specialty, which probably around the same salary as the general anesthesiologist.
Why did you decide to pursue this career?
Well, to answer the question, there's two steps. First, I got into medicine mainly because I wanted to help make people better. And that was the driving force for me to go into medicine. And once I'm in medicine, I started exploring. At first, I wanted to become a cardiothoracic surgeon, to fix people's heart. But it turns out that I realized that anesthesia or anesthesiology is what best suits my personality. And that's why I decided to go into it. And I'm very happy ever since.
Did you face any challenges on the path to your career?
No special or particular challenges besides the common things of getting good grades in school, applying to medical school, going through interviews, and then after medical school, you apply to residency, and the biggest thing is to take care of take good care of your patients.
What would you say would be the hardest part of that process from going to college all the way to residency?
The hardest part would be to balance how many schools you need to apply to get accepted to medical school. I think that's the critical part of that whole process. Once you're in medical school, everything is sort of laid out by itself for you to follow.
Mm. Does someone in your profession experience traumatic events?
Yes, definitely. Although fortunately, it rarely happens. Imagine a scenario where you have a very sick patient and you, despite your best effort, you still cannot save the patient as they go through surgery. Or another scenario, you have a patient going through surgery and suffer some sort of injury under your watch, despite your best effort. So those kind of experience would leave a very traumatic psychological effect on the anesthesiologist.
Here's a happy question. How does your profession impact people's lives?
Well, it's a happy question, and that's exactly what we do. We bring happiness to people by making the impossible possible. Imagine someone who needs a knee replacement because they cannot walk. Right after the surgery, now they can walk again, they can play tennis again, they can do their regular activities, they can have their quality of life again. So that to me is the best thing, happiness for them. Or another experience, or another example, we help people give birth to babies, do C-sections, and every time that a baby is born into the world, that's to me is nothing can compare to that type of happiness.
What is the least satisfying part about your career?
As I mentioned earlier, it's the amount of time that we get to spend to know the patient before the surgery, because we never see the patient prior to that moment. And during that short time span, we had to develop rapport with the patient so that they can put their life into our hands and trust that we'll take good care of them. So that's the most difficult thing for me in this profession.
What is the most satisfying part about your career?
It's the instant effect that I can do for the patient. Imagine someone's having a lot of pain and I come and do something about it, and hopefully within half an hour, patient feel better right away. Or seeing a newborn baby coming to the world with all the happiness surrounding that baby, to me is the best experience, and I'm very fortunate to be part of it.
What is something you wish everyone knew about your profession?
Well, the thing that when people think about medicine in general and anesthesia in particular is that people don't realize that the practice of medicine or anesthesia is really not the practice of science, but it's rather the practice of art. Because no two patients are alike. The effect that you see in one patient might be very different in another patient. So whoever is thinking about this career need to keep that in mind. It's a practice of art, not science.
So would you say that you have to apply beyond textbook knowledge when you're in practice?
Absolutely. And it's regardless of how much training you go through, it really depends on your experience and your connection with that patient, with that particular patient, that allows you to provide the best care to that patient.
So there's a huge emphasis on patient-to-patient interaction.
Exactly. It's the interaction between the healthcare provider, the anesthesiologist, and the patient, and the feeling, the sense of that connection. If you don't have a good sense of that connection, more likely you're going to do more harm than good for that patient.
What is a common misconception about your profession?
Now, people usually compare us anesthesiologists to bartender because most of them, after seeing the anesthesiologist, they feel drunk So, which is no part of it is true. However, that's the misconception. We do a lot more than just provide uh, the medicine to make people drunk. It's, it's an art.
Hmm. How has your profession changed in response to this pandemic?
Well, because we, in the operating room, we are the people that's closest to the patient's airway, the patient's head. So therefore, we incur a high risk of getting COVID-19. So because of this pandemic, we become more vigilant about that possibilities. But overall, our approach to patients is very similar to before.
Hmm. What classes did you take in high school that helps you now in this career?
Well, we alluded to that earlier. It's not just the math, science, and chemistry that would help you, but more importantly, I think psychology is one of the courses that helped me greatly in practicing this anesthesiology, because you need to develop your rapport with the patient, understand their psychology before they go into surgery, and help them feel better about putting their life into your hands.
What kind of student were you in high school?
I would consider myself an average student, but I was a very active learner. I pay a lot of attention to details, and I asked a lot of questions when I was in high school or even in college.
What college or university did you attend, and what was the atmosphere like?
I went to UCLA in California, and looking back, I think the atmosphere was very friendly because I received a lot of support from the college professors as well as the teaching staff. So overall, it was a very positive experience for me.
What education and training was needed for your career?
Well, besides college, we had to go to medical school, which was usually 4 years back then. These days, there's a combined program between bachelor and medical degrees, so that might shorten things a little bit. But after that, you have to go into residency for another 4 years. If you want to specify or specialize further, then it might take another year or two.
Do you have to complete continuing education classes every year, or sort of recertifying or renewing your license every year?
Yes, we have to take continuing medical educations yearly. Not only that, we have to do that quarterly as well. And we do that so that we can renew our state license, medical license every 2 years, as well as renewing our anesthesiology board certification every 10 years. So there's always constant learning. You never stop in medicine.
Are you seeing evolvement in like anesthesiology, like things are becoming more technologically advanced over time?
Yes, just like everything else in medicine, we keep evolving, and there's more technologies. But the main thing about medicine is that it never takes away the art of medicine. That is the connection, it's the personal connection between you, the provider, and the patient. The more you rely on technology, maybe it helps you manage the patient better during the surgery. However, it cannot the overall experience, it doesn't make the experience better for you from the patient perspective.
How did you pay for your education?
In college, I had student loan and financial aid. For medical school, I had both student loans, and I was fortunate enough to have help from a family member. So it's a loan from a family member for medical school.
And what is your best piece of advice for students interested in this career?
The best piece of advice for anyone interested in medicine in general and in anesthesiology in particular is that you need to believe in yourself. The guiding principle that you should follow for anything in life is that if other people can do it, so can you. That way you can be successful in anything.
All right, that concludes all the questions. Thank you so much for joining me here today, Dr. Tran.
Definitely. Thank you for having me. And it was a pleasure sharing my experience with the future physicians.
Hello to everybody who's watching this career chat video. My name is Joan Dixon. I'm the Director of Student Programs at Gulf Coast South AHEC, and I just wanted to pop in and say a very big thank you to Crystal Tran, who is our interviewer today. She's doing a wonderful job as part of our REACH Public Health Internship Program, so thank you for that. And of course, thank you, Dr. Tran, for joining us today to give us some of your busy time and your expertise and knowledge. I'm sure that all of the students watching this have learned so much. And I look back and, I've been through various surgeries, and I was so reliant, not just on the surgeon, but on my anesthesiologist. And every time, come in, say hello, get to know me, and okay, count backwards from 10. And all I ever remember is 10. I don't think
Yes.
I ever get to 9 and I'm out.
That's a very common perspective of patients who are having surgery. And
Yes, I'm very
that's the way we
thankful
want
that very thankful to not feel anything during surgery. So thank you.
Well, thank you. But we are fortunate to have that ability to help patients that way. And thank you for having me on the program. It was a pleasure.
Absolutely. And students, if you're interested in more information about our free student programs, you can see the roadmap to success on your screen. You can see our website at the bottom, as well as my name, phone number, email address. Contact us anytime to learn more about our programs. Thank everybody for joining us today.
Wonderful.